This is going to be Critical Care Pharmacology Part 11, Antibiotics and Antifungals. Antibiotics and antifungals are used when you know what a specific organism is. And let me make note of this, specific agents, whenever they have been identified. Now this is where if you have somebody that's septicemic, the blood cultures come back and they can identify a specific organism. Broad spectrum agents are used when infecting organisms are unidentified. So if you don't know what it is, you kind of cover all your bases. So these are going to be multi-spectrum antibiotics that are utilized whenever you don't exactly know what the invading organism is. Cefazolin sodium, or Ancef, you class on this as an anti-infective antibiotic. It's a cephalosporin, first generation. Actions: serves as a cephalosporin type bactericidal, acts against both gram-positive and gram-negative bacterias. And just to kind of overview this, we identify the bacteria by how they stain. Gram-positive bacteria, they stain dark blue or violet by gram stain. And gram-negative bacteria, they can't retain the crystal violet stain. Instead, they take up the counter stain, or the saffron, and they appear red or pink. Gram-positive organisms retain this, and they'll look crystal violet, and then the gram-negative stains will be pink. Now, by their structural integrity is how they stain. So their actual outside capsid that's on their wall. So each one of these have different virulence, if you will, and will require different types of antibiotics. So we identify them by how they stain. Ancef works on gram-positive and gram-negative. Kind of a multi-spectrum. Indications. Skin or soft tissue injury. So if you have a cut, if they're doing surgery, they may give you a preparatory shot of Ancef so that an infection doesn't get out of control. Contraindications: known hypersensitivity. Side effects on this: nausea, vomiting, diarrhea. It can also cause, due to its type, something called Stevens-Johnson syndrome, and it's essentially an autoimmune mediated hypersensitivity. It pretty much will slough off your skin, so it's also scalded skin syndrome, is what they've called it as well. Look, you can Google this, and it is very shocking, the result of a simple antibiotic. Pardon. Dose on this: 1 gram, 50 mils IV over 15 to 30 minutes every 8 hours. Pediatric, 25 milligrams per kilogram IV administered in 3 doses over 15 to 30 minutes every 8 hours. Special considerations: monitor for allergic reactions. Use cautiously in patients with penicillin allergies. Rocephin, or Ceftriaxone sodium. Class on this: anti-infective antibiotic. It's a cephalosporin, first generation. Action: serves as a broad-spectrum cephalosporin type bactericidal. Acts against gram-positive, gram-negative, aerobic and anaerobic organisms. Now, aerobic and anaerobic organisms, some of them can actually live without oxygen, and those are going to be the anaerobic organisms, and some of them will require oxygen, and those are going to be the aerobic. So this one here, Rocephin, gives us a much broader spectrum whenever we're giving it. It's the one that we generally utilize in the acute care or in the emergency room to, if we don't know what the organism is but we want to get something on board, Rocephin's probably a good choice. It also crosses the blood-brain barrier, so it's good for meningitis as well. Indications: otitis media, septicemia, meningitis, post-operative infections, and preoperative prophylaxis. Contraindications: allergy to cephalosporin groups of antibiotics. Side effects: nausea, vomiting, diarrhea. Leukopenia, decrease in a number of white blood cells, that's what that is. Pain at the injection site. Dose on this: 1 to 2 grams in 100 mils IV daily. Pediatric, 50 to 75 milligrams per kilogram IV daily. Special considerations, again, monitor for allergic reaction and use cautiously in patients with a penicillin allergy. Primaxin, Imipenem-Cilastatin sodium. Class on this is going to be anti-infective, beta-lactam antibiotic. Action serves as a broad-spectrum carbapenem type antibiotic. Acts against gram-positive and gram-negative aerobic and anaerobic organisms. Again, covering most of our bases, very, very broad spectrum. Pardon me. Beta-lactam antibiotics kind of work by inhibiting the cell wall biosynthesis in a bacterial organism. Most of them decrease the cell's ability to proliferate or copy itself. Carbapenems are used for antibiotic resistant patients. So if we have somebody that may be antibiotic resistant and we need a broad spectrum still, we still haven't identified what's actually wrong, this might actually be a good choice. It is a multi-spectrum. It works by stopping the bacterial's growth pattern or their ability to make more bacteria. And it works on positive, gram-positive and negative, aerobic and anaerobic, with and without oxygen bacterial types. Indications: the need for broad spectrum protection. Contraindications: allergy to imipenem and its derivatives. Side effects: nausea, vomiting, diarrhea, leukopenia, low white blood cell count, pain at the injection site. Dose on this: 250 to 500 milligrams in 100 mils over an hour every 6 to 8 hours. Pediatric: 10 to 15 milligrams per kilogram every 6 hours. Special considerations: monitor for allergic reactions. Use cautiously in patients with impaired renal function. Vancomycin hydrochloride, or Vancomycin, anti-infective antibiotic. Serves as an antibiotic agent against gram-positive, gram-negative, aerobic and anaerobic organisms, including MRSA, or methicillin-resistant Staphylococcus aureus. This is going to be a staph infection that is resistant to the normal antibiotic that would do it in or kill it. Indications: need for a broad spectrum antibiotic protection. Contraindications on this is going to be known hypersensitivity. Side effects: nephrotoxicity, pseudomembranous colitis, ototoxicity, neutropenia, drug fever, and then pain at the injection site. Okay, ototoxicity would be internal ear damage. Neutropenia is a low number of neutrophils, so this is going to reduce your white blood cells, and the ones that are macrophagic to the neutrophils. The long version, or the long name on them, is polymorphonucleated white blood cells. It's what they look for whenever they do cell differentials for left shift, right shift as well. If your body is kicking out bands, which are the nucleuses haven't separated yet, they all look like kind of a band inside of the nucleus. If your body's kicking out bands, then it's producing immature white blood cells to fight an infection. Drug fever, pyrexia, caused from an immune response or antibody development is what we generally get that from. This is a very powerful antibiotic, vancomycin. And there are bugs out there currently that are resistant to this as well. VRE being one of them. Vancomycin resistant enterococci would be one of those. Dose on this is going to be adult 0.5 grams to 1 gram IV over an hour every 12 hours. Pediatric 10 milligrams per kilogram IV over 1 hour every 6 hours. Special considerations: monitor for allergic reaction. Monitor IV site for irritation and infiltration. Gentamicin sulfate, or Garamycin. Class on this is an anti-infective amnioglycoside. Action: serves as an aminoglycoside type antibiotic against infections in the central nervous system, respiratory, and gastrointestinal systems. Now, antibiotics in general pretty much set up an environment where the bacteria cannot proliferate or cannot continue. Indications: individual system or systemic bacteremia. Contraindications: known hypersensitivity to aminoglycosides. Side effects: nephrotoxicity, neurotoxicity, confusion, urticaria, drug fever, nausea and vomiting, and joint pain. Dosing on this is going to be 1.5 to 2 milligrams per kilogram IV over 1 to 1.5 hours. Pediatric dose 6 to 7.5 milligrams per kilogram. Day total IV is divided doses every 8 hours. So this is going to be your total dose right here. And that's going to be divided into 3 regimens every 8 hours. Special considerations: monitor for allergic reaction and monitor the IV site for irritation and infiltration. Clindamycin hydrochloride, class anti-infective antibiotic. Action on this: serves as a bactericidal agent against anaerobic bacteria, Enterococcus, Staphylococcus, and Streptococcus. Indications: severe infection, septicemia. Contraindications: allergy to clindamycin or lincomycin. Side effects: colitis, diarrhea, metallic taste, and a rash. Dose on this: 300 to 900 milligrams IV over 1 hour. Pediatric 20 to 40 milligrams per kilogram per day IV over 1 hour. Special considerations: monitor for allergic reactions. Discontinue infusion if GI symptoms occur. Ampicillin or Unasyn. Class on this is going to be an anti-infective, antibiotic, aminopenicillin. Actions: serves as a penicillin class antibiotic. Acts against many gram-positive and gram-negative and anaerobic organisms. Sulbactam components helps treat resistant strains, and that would be this is a dual antibiotic. Other dual antibiotics are out there. Another one that we're commonly familiar with is Augmentin. Augmentin has an additional acid in it to break down the capsid layers of specific bacteria, more commonly otitis media. The primary antibiotic in Augmentin is amoxicillin, and the primary antibiotic in this is going to be ampicillin. The sulbactam helps get the ampicillin inside so that they can kill the bacteria. Indications: respiratory, urinary tract, and postoperative infections. Contraindications to allergy to Unasyn and penicillin groups. Side effects: diarrhea, abdominal distension, flatulence, rash, facial swelling, candidus, which is thrush, and fatigue. Dose on the adults: 1.5 to 3 grams ampicillin equivalent in 100 ml IV over 30 minutes every 6 hours. Pediatric, more than 40 kilograms. Full adult dose in 50 to 100 ml of IV solution over 30 minutes. If they're under 40 kilograms, 300 milligrams per kilogram daily in 50 to 100 ml IV over 30 minutes. Special considerations: monitor for allergic reactions. Diflucan or Fluconazole is an antifungal, anti-infective antibiotic. Antifungal is a class. Action: it inhibits fungal cytochrome P450 sterol, C14 alpha demethylation. It pretty much inhibits the fungus from fundamentally growing, inhibits fungal growth by increasing its cellular permeability. So it essentially makes it to where the fungus is easily broken down. Its defensive systems aren't as well as they should be. Indications: candidemia and disseminated candiditis, and this is thrush. Either the thrush is in the blood or it's running around and it's in areas that it should not be. Fungal pneumonias, cryptococcal meningitis. Contraindications: allergy to Diflucan or azole class of antifungals. Side effects: nausea, headache, skin rash, diarrhea, or liver insult from the active metabolite being formed. Dose on this: adult 200 to 400 milligrams in 100 ml IV over an hour. Maintenance dose 100 to 200 milligrams in 100 ml IV over an hour daily. Pediatric 6 to 12 milligrams per kilogram per day and 50 ml IV over an hour. Maintenance dose 3 to 6 milligrams per kilogram in 50 ml IV over an hour. Special considerations: monitor for allergic reactions. Use cautiously in patients with renal impairment. This ends part 11. You got any questions, feel free to contact me. My name is Roy Smith, roy.smith@redlandscc.edu or smithr@imsa.net.